Hi, welcome to Chapter 4, Caring for Children with Special Medical Conditions. So we're just going to take a look at caring again for children that may have some medical needs. So let's look at that. So first of all, I want to introduce you to inclusive education. When you hear inclusive or inclusion, just remember that this is a philosophy and practice whereby children of all abilities are included and integrated into the same classroom. You'll hear inclusive education often, and it is on all campuses throughout California and our state. And for example, it's if a child has some disability, they should be able to go into a classroom as a general ed class and be able to go in the same classroom as children with no disability. Okay, so there is Individuals with Disabilities Education Improvement Act, and you hear that a lot. It's called IDEA or IDEA. And then also this is because it builds on children's strengths and addresses their limitations and promotes success. Okay, so again, we do have inclusive education in our schools. And why is early identification and intervention important? So think about you working with children, or you have a child. The earlier the better if you identify any health concerns. For example, you hear about milestones. So what children should be doing about this age. For example, a toddler should be able to say so many words at 2 years old. And let's say your child is not talking at all, doesn't have many words. There may be a concern. So you want to make sure that you reach out to regional center if they're below the age of 2, and regional centers in LA County and Orange County, and actually 21 different sites. Or you could, if they're 3 years old and above, you can go to your local school district and ask for an assessment on your child. So you can go into the office or call and say you have some concerns about your child, and they'll ask you some questions, and then you can definitely get the ball rolling to help them with any developmental concerns. Okay, so again, getting early intervention is very important. Also, with intervention also comes knowing the child. There's lots of children today that have some food allergies. So again, lots of peanut allergies right now, egg allergies, milk allergies. There's respiratory allergies. Again, knowing these types of allergies to foods, and also just allergies with the respiratory is very important also to know. It does state that children in the South are more likely to have respiratory allergies. This may be due to rain and pollen counts. So allergies could be hereditary, are not outgrown usually, are classified according to allergen and substance that trigger reaction. So a lot of times as preschool teachers, it's really good to go on the website to show how much allergens are in the air or unhealthy air levels. So this is good to know, especially if you have children with respiratory or really high allergies. Maybe to limit the outdoors because it's very unhealthy for sensitive children, just to be aware of that. Okay? And then also there's a video that you can watch and click on if you want to watch more. about any allergy responses and respiratory. There's that part also in the book. It talks about allergies of children in chapter 4. So again, allergies can affect children's behavior. So just remember, sometimes it makes you like not feel like yourself. You may be stuffy. Maybe you didn't sleep well. So again, these can affect the child's behavior and interest in learning. Teachers play an important role in observing children with the 4 signs of possible allergies. So what can these signs be? Okay, so you as a teacher, it's important to know these signs that maybe they're rubbing their eyes a lot, sniffing, not breathing well. Maybe you notice that a child that didn't have any milk allergies, but soon after drinking milk, maybe their tummy hurts or something like that. So again, just to be able to do daily observations on children will help the better overall health of the children in your class. And also asthma. Asthma, again, is very common. 1 in every 11 U.S. children younger than 18 years has been diagnosed with asthma. And that's still the case today. So it's still a high rise in asthma. Boys and non-Hispanic Black children experience the highest asthma rates. And children in poor health or in living poverty are 4 times more likely to be diagnosed with asthma. And here's a little kind of a scale that shows race and asthma by age, sex, and race. And then child asthma has a strong hereditary predisposition. So if a parent has asthma, sometimes it's higher likelihood that a child will. And actually asthma, which is interesting, affects more boys than girls. So I definitely see that. More boys are affected with asthma than girls. So really know through the health screenings that the parent gives you what any allergies or health related risks that the child has, you really need to be informed of. Okay? And then those increasing environmental factors are allergens, secondhand smoke, certain chemicals, and early feeding practices are among the high risk of asthma. And again, it shows you the airway that makes it difficult for children to breathe. So you can see the one airway that's super open, that you can get the air, feel good, and then those with asthma has very swollen or tightened airways. So I guess that would be definitely not a good thing to feel, right? So just being aware of if a child needs an inhaler because they're having difficulty breathing, just to be aware of that and have their inhaler in a place where all staff know about it. It's easy to get to. It's usually above like a refrigerator in a little cabinet that's high so children cannot reach it. And again, that they can have it quickly. And then again, exposure to different elements in the environment can help reduce attacks. Sometimes children can't run around as much, so just to make sure to have the child sit at certain times, maybe go in the shade and hydrate. And then there's anemia, a blood disorder that reduces the number of ability of red blood cells to carry oxygen to the blood tissues. So again, in our Chapter 4 book, it talks about anemia, who's at high risk for developing it. And also, unfortunately, there is childhood cancers. Only 1 in 2 children per 10,000 usually develop cancer in a given year. To me, that's still too high. The good thing is, oh my goodness, we have so much more improved treatment for children with childhood cancer. And diabetes. So diabetes, again, is on the rise. Approximately 1 in every 400 to 600 children have type 1 diabetes. Approximately 30 to 50% of children under 18 are currently diagnosed with type 2. So type 1 is more rare, and type 2 is on the rise. The type 2 is usually associated with being overweight or obese. And then again, American Indian, African American, Mexican American, and Pacific Islanders are actually at a higher risk for developing diabetes. Early diagnosis and treatment is essential. So really knowing how children eat, how their BMI and weight is are some early signs of diabetes. And of course, having children move more, be active, and eat healthy can help with diabetes. And then also there's lead poisoning. So lead poisoning is usually found throughout old houses, like through paint. Now there has been a study done that lead is in a lot of baby products, like formula was recently recalled. There was the candy that had lead in it, also recalled. So children usually 2 to 4 are at a greater risk for developing lead poisoning. And I usually have a guest speaker that talks about lead poisoning, which is very informative for parents. So again, please read chapter 4 to learn a little bit more about lead poisoning. And also, if a child has a high lead poisoning, it will cause some developmental problems. And again, let's look at some more through chapter 4 that you can look into about lead poisoning. And then also some children may have seizure disorders in your classroom. 2 million people in the United States have experienced seizures or been diagnosed with a seizure. And then 300,000 are children under the age of 14. So those children that have neurological or genetic disorders such as cerebral palsy, fetal alcohol syndrome, and Down syndrome are at a higher risk for experiencing seizures. So if you have children with those, they do experience seizures at a higher rate. So most facilities, child care centers, go over CPR and seizure work trainings or workshops with their staff, just to be, understand and know how to help those that go through a seizure. So here's a management of seizures. So most seizures last less than 2 minutes. Call immediately for emergency medical assistance if the seizure lasts more than 5 minutes, or a child has difficulty like breathing, or has no history of seizures. Personally, I would probably call emergency 911 if this happens. Observe the child closely for breathing, roll recovery position, and again, there's even more information about this on chapter 9. And that concludes our slide of chapter 4.